Welcome to Caring.
Welcome to Caring Well.
Welcome to Caring Well.
Welcome to Caring Well.
Welcome to Caring Well. Welcome to Caring Well.
Welcome to Caring Well.
Welcome to Caring Well, a Middleton Pediatrics podcast where we have conversations to help you care well for your child. Sara Pate returns for part 2 of our 3-part series on vaccines. This episode, we talk about vaccine safety as well as continue to talk about specific vaccines that are recommended for your child. If you have any vaccine-related questions, we would love for you to send those along, and you can do so through the link in the description. And now, let's join the conversation.
Dr. Middleton, welcome back to Caring Well.
Yeah, well,
great.
thanks. Thanks for welcoming me to Caring Well.
Of course, thank you for being here tonight. We're going to get started with episode 2 of our vaccine series. But really quick before we get started, I just want to recap episode 1 for those that may not have been able to listen. We talked about just some common misconceptions when it comes to vaccines and some common reasons that parents may feel hesitant. And then we kind of took a deeper dive through hepatitis A, hepatitis B, and polio. But tonight we're going to switch gears just a little bit and talk about safety, which I think might be one of the most important questions when it comes to vaccines. So I'm going to walk you through how are they tested, how are they monitored, what's in them. And then we'll also take a little bit of time and just walk through another handful of vaccines. So,
Great.
You good with that?
Yeah.
All right. So let's start with the big picture. If I'm a parent and I'm just wondering, how do I know that vaccines are safe? And kind of to piggyback on that, how are they tested? Let's start there.
In medicine, maybe this is true outside of medicine, but in medicine, safety is this big idea of benefit outweighing risk. And you really, it sounds so elementary to say that, but you kind of need to say that because there is no medical intervention that has zero risk. And sometimes when people are talking about vaccines and safety, it's a little bit of a misdefinition because they're talking about risk and not putting it in the context of benefit.
Yeah. I do feel like it's one of those, not to cut you off, but just and other things in medicine, I feel like parents don't have that big of an issue with knowing, hey, there's risk and benefits with everything. But with vaccines, it's almost like, hey, we don't want there to be any risks, or if there is any risk, then maybe we shouldn't. And so I understand that fear, I guess, but wanting just to talk through how can we feel comfortable that they're safe?
So you can't consider safety without considering both. So the benefits and the risks. So I mean that's a good starting point. And safety is really just when the benefits are significantly more than the risks, right? And so that's a starting point. I think how they're studied, it's very programmed. You have these preclinical studies that are essentially in a lab, and then you get these studies with people. And so they have phase 1, phase 2, phase 3, each one being progressively larger as far as the number of people included. Initial ones looking mostly just at safety and tolerability. And then as it gets bigger and the phase 3 where you are getting into placebo controls and you're looking at efficacy as well, which gets a little bit tough and we can talk through that. But anyway, you're talking about tens of thousands of people that are in these studies at phase 3. And those are the phases that are all pre-approval. And so, we could go as deeper than probably most people want to go, but to the FDA is what approves vaccines. Yeah. And prior to approval, they have preclinical studies, phase 1, phase 2, phase 3. I do think it's sort of helpful to compare and contrast with medications, which go through a similar thing, preclinical, phase 1, phase 2, phase 3, placebo control, and things like that.
But much less rigid, right?
Yeah, and the numbers for vaccine studies are like 10x
Huge,
what they are for medicines, and that is totally appropriate. You're giving,
as it should be.
You're giving vaccines to healthy people,
right?
As opposed to a medication, which you are sort of by definition given to someone who has a condition.
Yeah. And
so the standards are so much higher. And so even like if you were just giving this high level, at least one of the ways I would think of it is vaccines, medicines, and the things that are in foods. And I feel like people sort of lump them together, or maybe don't even ask questions as much about the first two categories. And it's almost as if the things in foods, you get to get in there until someone proves you aren't safe. That there's even a sort of part of the law that's the GRAS, generally regarded as safe.
But I think families think that's true of vaccines, that it's almost like anything can be in here until we prove that it's unsafe.
It could not be more untrue.
That's not true.
Not true at all. And so the standard goes higher for medications and it goes dramatically higher for vaccines.
So as a pediatrician, a dad, do you have any worries about how vaccines are tested, and are they tested enough? Are they safe enough to give to children?
No, because probably the main reason is because what we haven't even mentioned, which is the post-approval studies. So everything we mentioned so far is pre-approval studies. And then once they're approved, the studies continue. And that's another one of the misconceptions that's thrown out there, is that once something gets approved, it's like no one's ever looking at it again. And it is, again, could not be more untrue. And so there's systems that some are called phase 4, but then there's also surveillance systems. And again, we could go deep into those things to the degree someone was interested. But the rigor with which these vaccines are studied even after approval is where I probably take even more comfort and confidence. In some ways, this was really kind of magnified with COVID. In some ways, the main purpose of the first studies is safety.
Right.
And then as you get into the later parts of pre-approval studies, it is looking at efficacy for sure. Yeah. But
first and foremost, we need to make sure it's safe.
Yeah. And then as you get into these long-term post-approval studies, you get an even better idea of efficacy and the potential for side effects, adverse things that weren't seen in the studies that involve tens of thousands of people, because now you're on the scale of millions.
Right.
And that's actually happened.
Yeah.
It's been shown to detect those things.
Yeah.
So in some ways, a lot of the confidence I get is because of the issues that have been detected.
Yeah. And I think, there's so many things I could piggyback off of that, but let me start just briefly with COVID. So you said, I have so many parents that when I dig deep into the root of where is this fear coming from, because it seems relatively new, the heart of it will be like, you know what? I think it just started with COVID. And I felt like that vaccine was so rushed and I felt so pressured. And it made me kind of just have this overwhelming pause on vaccines in general. And so can you speak to a little bit why that doesn't worry you, how the technology wasn't new? How did we know it was safe if it was rushed?
COVID, there's so many different ways to talk about it, and it deserves its own episode, including a lot of the things that didn't go right with COVID. I do think there's a little bit of amnesia or revisionist history.
Hindsight's 2020.
Yeah,
maybe.
there were, at the time the vaccine came out, there were about 300,000 Americans that had died. If you just try to think back to that New York City spring of 2020 and the dramatic death rates, and even January 2021, you had 20,000 people a week dying of COVID.
No respirators, that
was the early part. And so it was, so anyway, again, you have to, that's part of the context. I think the thing that's interesting about COVID is the vaccine. And so again, separating out other aspects of COVID handling and communication and things. But the vaccine itself, it went through phase 1, it went through phase 2, it went through phase 3. What really was rushed was the, are we sure it's about its efficacy? So the safety, vaccine, serious complications from vaccines, when they've happened, they've been very rare, and they've essentially always happened within 2 weeks of the dose being administered. And really always happened within 6 weeks.
Yeah,
And
that's
so,
what I was saying. Even 6 to 8 weeks, like almost completely always.
which is why
yeah.
they did 2 months
Yeah.
for the COVID.
Totally.
It was saying, are we confident that
Yeah.
this is safe? We think it's effective,
Yeah.
but we really got to make sure
Safe.
it's safe. And
Yeah.
so that's why they did that,
Yeah.
that 2 month. And that's contrasted. So a phase 3 trial that was in terms of months compared with HPV that was 7 years,
Mhm.
that is rushed, right?
Yeah.
But why?
Yeah.
Because
Yeah.
of what was going on.
And resources were also all pulled together so that we could expedite the process of that vaccine without skipping those safety steps.
That's right.
Um,
So it was remarkable, but
Yeah.
it was, and even then it reached a point of emergency use authorization as opposed to like this FDA approval.
Yeah.
Anyway, and then the effectiveness, again, I don't know how people look back and remember or misremember,
Yeah.
but it was dramatically beneficial.
Yeah.
I mean,
I think what you said earlier, I think people tend to lump together the whole blur of COVID and miscommunication, things that rightly so may not have been communicated in an effective manner or in a timely manner.
are understood.
Right.
Yeah.
And so I think the vaccine gets lumped into that. And if we're able to separate like that from the other part of it, we can see more clearly that the vaccine actually was pretty effective. And
Dramatically.
Yeah.
Well, and even the going back to this pre-approval process, these post-approval surveillance, and the issue of heart inflammation in adolescent and young adult males, that was detected by these post-approval surveillance systems, and it was slightly increased. Again, not nearly as much as the incidence of heart inflammation with COVID infection.
from getting the infection, right?
But it was truly something that seemed to happen with the vaccine in that age population, and the system detected it. And so there again, you have confidence because of the systems in place and because of its quote track record.
Right. Yeah. We kind of touched on this a minute ago, but when we think about vaccines and long-term effects, I get questions about that all the time. And also that idea of autoimmunity and it causing like some autoimmune illness later on in life. So first, talk about long-term side effects. Do we see them? How do we know that in 40 years, it was the polio vaccine that caused this or that?
There have been some serious side effects from vaccines. And we talked last time about the rare but cases of paralytic polio from the oral polio vaccine. These cases of Guillain-Barré with flu vaccines and intussusception with the first rotavirus and things like that. So there have been these things. Again, they get detected, but they've always been within a couple weeks of the dose being administered. And then to your other question, how do you know there aren't? Through studies.
You look back at history, yeah.
And you look at these ongoing post-approval surveillance systems that are looking at things. The thing that gets really hard, and in some ways this is probably pretty obvious, but false associations with vaccines are so easy because you are giving it to so many people, right? That's different than medications. And so one, you're giving it to so many people, and two, a positive association in time is a really compelling anecdote, and a negative association is nothing. So for instance, if anything that tends to happen in the 12 to 16 month period of infancy, it will be temporally and time wise associated with the vaccines that are given in the 12. Yeah. And you're giving it to millions of kids. And so the only way you sort through that is with studies. Same thing. There are adolescent vaccines, and then there are conditions that tend to happen in adolescence. If you're giving adolescent vaccines to millions of people, you'll see. And so if you had a situation where someone was given a vaccine and within a month, the child developed leukemia, that's really compelling from a story. And it would be hard to convince someone that wasn't associated. If you gave a vaccine to someone and within a month they didn't get leukemia, it's nothing, right? It doesn't mean anything. And so that's why vaccines are so prone to false associations. those things do need to be looked at because a lot of these side effects like intussusception, like Guillain-Barré, they're rare. And what sorts through them are these large surveillance systems. And again, I take so much confidence in the fact that it has caught these
It's been
things.
caught, before. Yeah.
And autoimmunity has been looked at. But I mean, there's so much about, I think another thing about some of the concern with some of these conditions is when you take something that we just still don't know a lot about. And this is where autism, and this is also where autoimmune diseases, because there's a lot unknown about those things, they are ripe for a lot of question asking, which is completely legitimate. It's just with vaccines, the question has been asked and answered.
All right. So another question that comes up all the time is, what is in vaccines? And is it safe? Is it healthy? Can we talk through that a little bit?
A little word of caution is it's like reading a label on a medication or a food or something. It's a lot of things that the vast majority of us don't have understanding about. And so going back to what we said last time, everyone is trusting someone else. And so you've got to figure out who you're going to trust.
So maybe start with, what is a vaccine adjuvant?
An adjuvant is something that gives a better response to that vaccine, a stronger immune response so that it will work, basically. So aluminum is an adjuvant that's been used in vaccines for 100 years, a century. And it helps the immune response be stronger. And so a lot of the earlier in childhood non-live vaccines tend to produce a really good response. The inactivated ones often don't, in their natural state, don't give as strong of an immune response. And so an adjuvant is a way to increase the immune response so that you don't have to get as many doses as you might otherwise have to get. And so aluminum is an adjuvant that's used in a lot of vaccines and has been used for a long period of time and shown to be really, really safe. Going back to that false statement that once they're out there, no one's looking anymore. Just this past month, a 20-year study that looked at over 1 million children and aluminum as an adjuvant in vaccines, and it was looking at things like allergic disease, autoimmunity, and autism and various things. And again, found to be really safe. And but I mean, all of us, if we hear something like that, there's a little bit of alarm. And so going back to the first thing I said to that question, I would just be a little bit careful about trying to go through the ingredients and determine if I'm good with that with my kid. There's a context of a very real disease. There's a large body of evidence and a lot of experts and a lot of time that have been using these things. And so to just pull an ingredient out, look at it and try to evaluate, am I good with that being injected into my kid? I mean, even to say it that way, right? It's alarming.
Well, I think we have to get wise too in our ability to say, like, there's natural things that are naturally occurring that may not necessarily be healthy for us. And there's things, metals or, aluminum, that is naturally occurring and is not so bad for us in, small amounts. But as a parent, you hear, oh my gosh, it's a metal and they're injecting it into my kid. That must be bad. And that's just not the case.
Yeah, ingredients is another thing that is an easy target for fear-arousing misinformation.
Yeah. Talk just briefly on thimerosal. So thimerosal was removed from vaccines altogether. And so I hear parents say, well, doesn't that mean that that was harmful or bad? And now they've discovered it, and not so. So can you speak a little truth into that?
Thimerosal it's a preservative. So if you have multi-dose vials, to prevent contamination, you need a preservative. And thimerosal is a mercury-based preservative to keep the vials from being contaminated. There had been some concern raised by some studies. I won't get this right, but it feels like this. We're talking 30 years ago, 25 years ago, maybe probably 30 years ago. And despite studies that had shown safety, there were questions raised. And shortly thereafter, thimerosal was removed from all vaccines except some multi-dose flu vaccines. And so essentially, and even then, of the flu vaccine population, the vast majority are single-dose vials. And so for the last 20 years, there has been hardly any vaccines, only a small batch of flu vaccines, essentially, that have had thimerosal in them. And they kept studying it.
Yeah.
They kept studying thimerosal even once it had been removed. Like, hey, we want to know, was this dangerous? And the studies proved it safe.
As a parent, and if I were a patient, parent here, I would want to hear from you, like, do you have any concerns with the ingredients in vaccines as they are now? Or do you feel like all of those ingredients are safe for my kids and the kids that we serve?
Yeah, not even I feel. I mean, it's kind of what I've acted upon, right? I mean, I actually have children, right? And what we've done with all of our kids, and absolutely feel it's safe. Again, going back to the very first thing we said, safe is not an absolute term. Safe is a relative term, and it's relative risk and relative benefit. And vaccines are dramatically beneficial, which maybe we'll talk to when we talk about some of the specific diseases. But thankfully, they're also dramatically low risk. And so, that smallpox, which preceded all of us, a tough vaccine, but a really tough disease. And so were people going to get it? Absolutely. Because relative to the benefit, it's safe. But thankfully, the vaccines that we have are very safe, and they've gotten safer. I mean, including some almost at the slight expense of some of the effectiveness, like if we talk about acellular pertussis. But so really confident. And, we say all the time about what we do with our own kids or what we did do with our own children. And I will readily answer that question all the time. I do think it is telling of one's heart. I would love for people to know too that we care about every kid that walks through these doors. And so the idea of doing something to one of them that would be potentially different than what we would do with our own kid. I mean, it's kind of a guiding principle for everything we do. I keep coming back in my own mind, and what I would love for families to hear as well, this analogy of me in a plane and me telling the pilot, hey, I want you to tell me exactly the route you're doing, and so let me make sure I approve of that. Or talking to the airplane manufacturer, and why'd you use this type of metal, and why do you use this fuel combination? And because if I dove into those things, I'm sure I'd find stuff that to my untrained mind would be scary. And so you do have to come back to this position of trust, and who are you going to trust, and being careful about not creating situations where you're increasing your angst unnecessarily.
And I think that was, my reason for the question of like, hey, just plain and simple, like, do you have concerns about the ingredients in vaccines, Dr. Middleton? And just almost taking that for granted, thinking that patients you would think that they just know that we think vaccines are safe because it's what we do here. But just hearing you say, me say, whoever it is, hey, I believe in these. I feel like they're safe. This is why we do it. Yes, I gave all of these to my own child. I think sometimes that carries its weight in gold versus trying to go down this rabbit hole of every little thing, to prove it.
In fairness to parents, I think a lot of the problem is the benefit is almost completely unappreciated. And what I mean by that is the point of a vaccine is to make sure nothing happens. And so they've been so effective, a lot of nothing has happened as it relates to these diseases. You have a whole generation
that's never seen any of these things.
And so contextualizing for a family as your decision making and trying to think about a disease that you've never seen and no one of your peers has ever seen.
Right.
That's hard.
It's hard.
And so I think that's this idea of safety, benefit versus risk. If you don't take into account the benefit, it becomes a much harder calculus.
Okay, really quick. Another thing we're going to dive into is how are they monitored? And we've kind of talked about this already, but what I hear sometimes is if vaccines are so safe, why do we need VAERS? And why are these, events that seem kind of a big deal reported to this VAERS system? So what is VAERS and why do we need it?
The need for post-approval surveillance is because you're going from tens of thousands of people receiving it to millions. And if something is rare but real, it won't show up in the tens of thousands, but it would show up in the millions, which is actually exactly what happened with the heart inflammation and COVID. It's something that's happening at a rate of like 1 in 10 or 20,000. And so you're just not going to see many cases in the phase 3 studies. But then when you get into millions, you'll start to see a number of cases. So you have to have some sort of post-approval surveillance system. VAERS is one. VAERS is what's referred to as a passive surveillance system. Anyone can submit anything to VAERS, the Vaccine Adverse Event Reporting System. And so if my 4-month-old got shots and then I thought the head was getting flatter, I could report that to VAERS. There's nothing, and that's by design.
It's like a Yelp review, right? Like anybody can go on and say.
But it's by design because the idea is wanting a really early warning system that if enough people are saying something, that warrants looking into. Yeah, warrants study. And so that's the intent of VAERS. But because of that, if I went and reviewed VAERS, I might find 4-month-old vaccines causing head flattening. That doesn't mean it's real, but that's the way the system is set up. So when people talk about there are things in this adverse event reporting system and using that as evidence that's a complete misuse of what VAERS is. There are other surveillance systems that also kind of in the millions of patients. Some of them use big health system EHRs like Kaiser and things like that. And then there's some that use payer claims. But now you're talking about large tens of maybe hundreds of millions of patients. And so those are more active surveillance where they'll go and they'll mine the data in EHRs looking for things. And so that's more of an active surveillance system. And then like we talked about, you have phase 4 clinical trials. And so you need that because you're giving it to healthy people. You went from tens of thousands to now you're going to millions, and there might be rare things that show up. And so it would be irresponsible to not do that. Some of what is said, like if someone said, once these vaccines are out there, no one's even looking at them anymore. Lie, completely untrue. Others are more subtle where they'll say things such as, well, I'm not anti-vaccine, I'm just pro-safety. And again, whatever the intent is, there's an inference that they're not, that those that have studied them previously weren't pro-safety, that I'm just for more studies. And two things I'd say to that is like, great, because those have been and still are going on. Right. And so great thought, come on board. But if you're inferring that they've been lacking prior, that's not true. That's a lie as well. But they're easy lies. I mean, they're easy to put out there because it's a zinger. I always think about, it's a bumper sticker message. Whereas the truth is 23-page essay.
Years and years. Yeah.
And those those don't go down as well as bumper stickers.
Yeah. So just to speak to like the accountability and reassurance that I feel like parents want when it comes to vaccines are being monitored continuously, even after they're approved and they're given. It's an ongoing process of monitoring vaccines, correct?
It's a great one.
Yeah.
Yeah.
So I think that's important to remember, and leads me into, let's talk through just a handful of vaccines briefly. Measles. That's a fun one. It's a good one to start with. What is measles? And in the recent times, we've had this kind of uptick in measles. Is that real? Is it a real concern? Give me your thoughts.
Yeah, I mean, I think Brad and I talked about measles in one of the earlier episodes. Measles is the most contagious disease known to man. The idea, there are wonky numbers to designate how contagious a disease is. And measles is one that if somebody has measles and they come across people who aren't protected, one person will infect 18 others. And, compared to flu, which may be 2 or 3 type of thing. So an incredibly contagious disease, pretty high complication rate of neurologic problems, and a fatality rate about 1 in 1,000. And, it's another one of these things we talked before about someone saying that these diseases were already decreasing because of improved sanitation. Not true about measles. And prior to the vaccine, there were about 500 children who would die each year from measles. And going back to this, if we're going to talk about risk, talk about benefit, I was thinking that's like 3 airplane jets full of kids going down every year. So I mean, just tragic. And essentially, eliminated from the United States. So we talked before about the difference in eliminated and eradicated. But unfortunately, we now have this year the highest rate of measles we've had in 30 years. We've had the first childhood fatality in maybe a couple decades.
And I mean, that even just one childhood fatality speaks to it, but like, is the recent rise a real concern of measles?
Yeah, it's a dramatic concern. I mean, it's these measles, because it's so contagious, requires such a high degree of herd immunity that it become a real problem. It sort of has become, so it's potentially a really significant problem. We said before, measles will be referred to as sort of canary in coal mine because it's so contagious. If you're having sort of decreased vaccination rates and therefore reemergence of vaccine-preventable diseases, measles and maybe pertussis would be a couple of the ones you'd see first.
The first ones, yeah. Okay, what about mumps? Do kids still get mumps?
Yeah.
What is mumps?
So mumps is also a virus, contagious, not quite as contagious as measles. Its classic presentation is big swelling of the parotid glands, but it has other complications. It causes meningitis, can cause infection of testicles in males, and sterility, infertility. That was a fairly, a significant complication of mumps infection. Mumps does still happen. Mumps, as opposed to measles vaccination, which is really robust and tends to last long and strong throughout life, mumps immunity does wane. And so a lot of the mumps cases you'll hear about now are in college-age kids, and you'll have outbreaks on college campuses. Yeah.
What about rubella? What is rubella, and why do we still need to vaccinate for it?
Yeah, rubella is an interesting. One of the things you and I said last time is every vaccine has a story. And so if someone's throwing around blanket statements, it's probably untrue because every vaccine has a lot of things unique to it. Rubella, German measles, a very mild infection in kids, but really had this terrible manifestation of if a pregnant mom got infected, causing congenital rubella syndrome. So a lot of miscarriages, a lot of stillbirths, a lot of congenital abnormalities such as permanent deafness, permanent blindness, And so in the 60s, there would be 20,000 children a year with congenital rubella syndrome. And because kids are the ones that this mild disease, but spreading it, you immunize children. And again, congenital rubella syndrome is essentially gone. This
So if someone
dramatic
says
success story.
why do we still have to vaccinate? If it's like essentially gone, I mean, you could argue so was measles at one point. So why is it still important that we vaccinate our kids?
Two things I'd say to that. One, if you're saying that, at least acknowledge the reason you're saying that is the success of the vaccination.
Yeah, of those before you. Yeah.
And the second is it's fragile, and these things, they can come back. And so we'll maybe get to diphtheria. Diphtheria, just to mention it because it's in the context, it won't mention the disease necessarily, but this interesting kind of geopolitical meets infectious disease. When the Soviet Union fell apart, a lot of infrastructure of things fell apart. And so their vaccination rate, which had been really, really high, went really, really low. And so in the 80s, they had enormous number of cases of diphtheria, which people hear and you may think, isn't that like George Washington times and all this kind of stuff? And in the 80s, there were 5,000 childhood deaths from diphtheria in this country. And I mean, in that country, not our country. And so if someone says, aren't these diseases gone? Why do we need to still vaccinate? The reason that you feel that way is because of the vaccine, and they can come back. They've done that in the past, and unfortunately, measles is doing it now.
Chickenpox. I hear all the time, well, I had it when I was little and I'm fine, or we used to have chickenpox parties, So we're talking about the varicella vaccine. Why can't we just have chickenpox parties still? And talk me through that. What does it actually do to kids? What does chickenpox actually do to kids?
It's kind of a miserable illness. A lot of the serious cases, candidly, were in older, either older children, older adults or whatever. But even in kids, again, there'd be, prior to the chickenpox vaccine, about 100 deaths in the United States each year of children. I mean, one jet airliner full of children. And so anyway, it's not as bad as some of these other things, admittedly, but still bad. And that we probably haven't, I don't know if we've had a childhood chickenpox death in a decade. And so you had something that was, 100 and probably another 100 or so adults or whatever, and that's gone to zero. The other thing interesting, I mean, about almost all these, varicella vaccine, for every dollar spent on varicella vaccine, there's about $5 to $6 saved in healthcare spending. So one of the, when you're looking at cost effectiveness in healthcare, they talk about how much are we willing to spend to get this positive effect. And so a lot of times the positive effect is a quality adjusted life year, QALY, whatever. And so like, for instance, a mammogram, it's like $30,000 for each quality adjusted life year. And that's considered very cost effective in America, in the United States, arbitrarily, but anything under 100,000 for a quality adjusted life year is considered cost effective. And so colonoscopies are like probably $10,000 to $20,000. Varicella is actually saving money. So it's not that we're willing to spend this much. And that's true of essentially all childhood vaccines. Some of the adolescent vaccines fall into this category of cost effective, like mammograms, colonoscopies, but the majority, essentially all the childhood, are cost savings. And so you kind of think, all right, if you're just an economic conservative, you should love vaccines.
Should really love that.
I mean, there aren't many things in medicine that do that.
Actually,
and varicella is an example. And so if someone said, hey, isn't it a mild disease? And in many cases it was, some cases it wasn't, and those need to be acknowledged and they can be prevented, but it's also got other real benefits.
Are live vaccines more dangerous than inactivated vaccines?
No, not more dangerous. There's sometimes some more side effects that you can see, but they're mild side effects. That's why I would say not more dangerous. And so you can get milder versions of, so you can get a few bumps and, instead of the hundreds of bumps you get with chickenpox, or similar with measles, you can get a day or two of fever. I think one of the things interesting about this goes back to something you asked earlier. The side effects of vaccines usually are things that the illness itself does, but very much milder. And so even the idea, so COVID's a great example. COVID had this propensity to cause myocarditis in adolescent and young adult males. Well, the vaccine did that in much lower numbers and much milder scenarios. And so most of the times when you see side effects, it's something that the illness does, but a much smaller version of it. But live vaccines are safe.
We kind of touched on diphtheria. Anything else we need to say about that? Maybe why is DTaP one of the first vaccines that babies get, and why do they need so many in a row?
Yeah, you need so many just because you're trying to mount a protective immune response, and it's just not easy with a young child. The reason it's given when it is because the disease affects young children. And so the most prominent part of the DTaP probably is the P, the pertussis whooping cough. And that too is still very much with us. I mean, that's just a couple of infants just last month or so in Kentucky died of pertussis. And we have cases of pertussis in our own community. But anyway, diphtheria, terrible, basically a suffocating type of throat infection. Almost, I think people would even refer to it like malignant croup. Tetanus. When you got tetanus, 10% of everybody got tetanus died. Period.
I do get the question, tetanus is not contagious, right? So why do we need to be vaccinated for it? Or, little babies, why can't you just get one shot and be done? But speak a little bit to tetanus, especially in infancy.
Yeah, the immunity, the reason you need more shots, the immunity is a little bit hard to get it up to protective level. And then it also wanes, which is what pertussis does too. And so you have to have boosters. And then, a lot of the cases of pertussis, the cases of tetanus would be things like medical procedures, things related to things done to babies in delivery, or minor surgeries or minor cuts.
Right.
There's this weird paradox where, at least in the U.S., most of the cases of tetanus that would happen would be minor, not major. Major cuts people clean.
Yeah.
And minor stuff people blow off. You know? Anyway, so
interesting.
So that's why it's done when it's done.
Yeah. Okay. What is Hib?
Hib is we said before that smallpox is sort of the quintessential vaccine success story.
Yeah.
Hib is like a close second.
Yeah.
Haemophilus influenza B. I think there'd be 1,000 deaths in the 80s. So again, this is not
that long ago.
Yeah, I feel like it's not that long ago. This was the 80s. You'd have about 1,000. It's always childhood with Hib. So using whatever, now we're talking 6 or 7 or airline, jets of children, and 20,000 cases a year. And within a couple of years of Hib vaccination,
pretty much gone.
Gone.
That's amazing.
And so there was just in the last couple of months, older, an 8-year-old or maybe a 6-year-old who died of Hib I think in Indiana or something, an unvaccinated kid. But it's essentially, you don't see it at all anymore. And it happened really, really quickly and dramatically.
Yeah. Okay.
And so even when I was training, the doctors were constantly talking about Hib. They're talking about the meningitis cases, the epiglottitis cases, the sepsis cases, because they had seen them just a couple of years ago.
Yeah.
It wasn't distant for them. And it
just changes your perspective. When you have seen something that wasn't this distant, illness,
and
it was a
for
reality.
An outpatient pediatrician in the early 80s, it was the thing probably feared as much as anything, that you'd have this child come in, and specifically epiglottitis. So it's always is this croup, which is going to be okay? Or is this epiglottitis, which may instantly be airway closing and fatal? And so that'd be what would walk into your 9:15 appointment. And so you could understand why those pediatricians were,
Pneumococcal disease. What does this vaccine, PCV, protect against, and why is it still needed?
Yeah, pneumococcus Streptococcus pneumoniae, a bacteria that also really common cause of meningitis, common cause of pneumonia, common cause of sepsis, blood infection. And so again, kind of like Hib, not quite as ominous, but still in individual cases just as bad. And all these were even children, and this is true of pneumococcal infections, true of Hib, the children that would survive, huge numbers had long-term disability. In the 80s, I think Hib was the most common cause of long-term childhood disability, Hib infection. And so again, it's not just the deaths averted, it's the hearing loss and the cognitive damage that's been averted with that. So pneumococcals Prevnar is very much the same as that, in the same category maybe. It also is a bacteria that causes ear infections. Unfortunately, I guess it's not been dramatically effective at preventing ear infections for lots of reasons. That was never why it was designed in the first place. It was pneumonia, meningitis, sepsis, but there's still a lot of pneumococcus around in this office every day. And so pneumococcus is not something of the past. It's very much of the present.
Okay, before we wrap up, I want to quickly address something that I've definitely seen circulating online. And so there's this claim that public figures, even like RFK Jr., have been saying that pediatricians make over 50% of their revenue through vaccines. So do you profit as a pediatrician from vaccines? Is that where our revenue comes from? Is that a big pusher for why we want kids to be vaccinated?
Yeah, I mean, it's an unfortunate statement because, well, a few reasons. One, first, it's just completely misleading. It's been well studied and over and over again that vaccines are usually, sometimes they're money losing. It's usually a wash. And in sort of best case scenarios, it's probably like a 3% to bottom line type of thing. The reason it's said is it's a high revenue item and a high expense item. So a lot of money spent on the purchasing of vaccines and then the reimbursement. And then you've got a lot of associated expenses, indirect expenses, storage, special refrigerators, employee effort. And so the vast majority of pediatric practices, and this is not an opinion, this is studied, is vaccines are not money making at all, often money losing. And when best case scenarios, as far as well run and better payer contracts or whatever that is, a very small number to a pediatrician's bottom line. So to me, it's an unfortunate statement for two, if not more reasons.
I mean, even with me, I think I brought it up to your attention. I was like, it says that 50% of the revenue, and that's just not true. And it was like, well, it may be 50% of revenue.
Yeah, it's a pretty basic business concept, revenue versus profit, right?
But even to the untrained ear, you're like, that's not true, but that doesn't mean it's profitable,
Right.
So,
yeah. And I think the other part that is even more unsettling is it feels like there's an inference there that pediatricians would do something financially beneficial, even though it's not good for kids. And that, that's offensive.
It's hard to let that not hurt your heart.
It also makes me think anyone says that doesn't know or hang out with many pediatricians. That's just so antithetical. And so to the degree that that's being inferred, it's very inappropriate in addition to being completely misleading.
Okay, so as we wrap up, let's just talk a little bit about the heart of all of this, which is confidence and trust in providers, healthcare systems. What wisdom do you have? And I think I asked you this last time, just to give to parents in a sense of how do we remain trustworthy in a world that has a lot of different voices that are speaking? So,
yeah, I think it is important to be in a relationship with someone that you can dialogue. And so we've said, and we talked about, Dr. Von Edwins and I talked about our vaccine policy in an early episode. You and I talked a little bit about this issue, and we've said we love talking about vaccines. We don't love having debates in the setting of a child's visit, but we do love talking about vaccines. And so I think the importance of being able to dialogue about it. I would say, as opposed to going and looking for content and seeing if that content is trustworthy, I would say we should go look for trustworthy sources and then look at their content.
So that brings me to my next question. And I think we touched on this last time too. I'm a parent. How do I know that a source is reliable or trustworthy? What is that?
I mean, one would
like?
be, it's more in the negative sense. If anyone has consistently said things that are not true,
Let's pause.
that person is not trustworthy.
Yeah.
And I put that same standard to us.
Yeah.
If you are consistently saying things that aren't true, like all these diseases were getting less because of improved sanitation anyway, or these vaccines aren't studied after they get released.
Yeah.
These statements that are completely false, they're lies. If someone is saying those things, I would say that person has shown themselves to not be trustworthy.
Right.
And so I think track record is some of it. I think there's
They're selling something.
Yeah, I mean, certainly. But again, that's almost like what people are using. Well, you're running a pediatric business where 50, this kind of. So I guess that even in some ways, someone would say everybody is selling something. But if you're selling your book about vaccines,
I just think it's like I see all these articles, or maybe not even articles, Instagram posts or whatnot. That's like, vaccines are bad for all these reasons, and then click here for the supplement that's going to keep your child healthy or whatever.
Yeah, that's a red flag.
That's an automatic, no,
You know what I love about what you just said more than anything is you made a distinction between an article and an Instagram
I said
post.
Article, and I was like, let's be honest, it's not an article.
We tried to have this discussion with my own children, and I would say, hey, there's this really neat article. I want you to read. Oh yeah, I already read that. It's like, you did? Well, no, I saw the
summary.
I was like,
on
well, then
Instagram.
you did not read the article, right? So I appreciate you recognizing there's a difference between the two. Yeah. So I think track record. I think there are other sources that I would say are trustworthy. We talked about some of these before.
Even like educational institutions, if people are hesitant with the CDC or whatever else, like I think, CHOP and look at other educational resources.
I would love for you to start with your child's pediatric practice. And if you don't feel like you trust them and they are not trustworthy, go find one that you do and that is. I would get a little more local with your trust than I would internet.
Yeah, I love that.
But I absolutely, and this transcends medicine. This is just, how do you navigate an age of information overload? It's not, I don't think it's survey all the information and try to determine what's accurate or not. I'd say you start with a trustworthy source and still hold that content through a filter.
Right. Filter all of that through.
Yeah. I mean, that's
starting point.
It's just a much better starting point, maybe is the way to say it.
Yeah.
Yeah.
All right. Well, next episode, we've got one more. We're going to talk about a couple more vaccines, teenage vaccines, and then vaccine schedule. So there's a lot of questions around alternate schedules, delaying. So we'll talk through that next time.
Great.
Thank you
Look
for being
forward to
here.
it. Yeah. Thank you.